Thousands of patients will have to wait even longer for surgery and in many cases a new lease on life as Ontario instructs hospitals to pause what it calls non-urgent procedures to deal with an influx of Omicron patients. But many families already struggling to access medical care fear the move could mean life or death for their loved ones.
I just want them to know that, my husband's life's not disposable.
Carrie, who CityNews agreed not to identify, says her husband was diagnosed with head and neck cancer in 2019. This past summer, he was told the cancer had spread to his lungs, making him a stage 4 patient. While chemotherapy has been effective, his last CT scan still showed a growth on the lung.
We're meeting with our oncologist on Thursday, and we were going to talk about whether or not they could surgically remove this last nodule.
Carrie worries surgery is now off the table.
You want to make sure that these patients are getting the surgeries they need as soon as they need it, so you're not waiting until the situation gets worse. The malls are still open, but we're canceling surgeries.
The CEO of Ontario Health confirmed Monday 8,000 to 10,000 surgeries will be added to the backlog every week.
It was a tough decision, a big cost, but something that is necessary given what we're seeing in the numbers.
The province says the new measures will free up 1,200 to 1,500 additional beds. But in some hospitals, the issue isn't beds, it's staffing them. Among the surgeries affected include life-saving surgeries and those that enhance quality of life.
My husband's in excruciating pain every single day.
Maggie says her husband was supposed to get a spinal cord stimulator at St. Michael's Hospital this month.
We've been fighting for this particular procedure for well over a year. There are many delays in trying to get it, trying to find a doctor to do it. We're having trouble covering his pain medication that he's on right now that gives some minimal relief, and his need is going up and we're having trouble covering that. So the spinal cord stimulator, the sooner the better.
The Ontario Hospital Association says in a statement, these are not trade-offs any of us wanted to make, but they are necessary now to protect hospital system capacity and health human resources. Carrie says families like hers are being left in the lurch.
I'm relatively young. I'm 39 years old. My husband's relatively young. He's in his early 50s. There should be a lot of life left for us.
The Canadian Cancer Society tells CityNews delaying cancer care by even just a few weeks could increase the risk of death by about 10%. Those and other surgeries will be paused during this latest wave until at least January 26th. Caryn Ceolin, CityNews.